Well, let's go ahead and jump right into our Health and Human Services Committee session on July 23rd. Today we will be discussing one item, which is a special appropriation of $395,000 to go to the Department of Health and Human Services to expand the great work of one of our most special nonprofit organizations in Montgomery County, EveryMind. And the context for this discussion is so important, and we just spent a very productive meeting and discussion regarding another special appropriation to stand up more mental health services for MCPS students, particularly in schools that are Title I, have more vulnerable students, and we're seeing a disproportionate number experiencing mental health challenges. And so I really want to give a lot of credit to my colleague, Councilmember Andrew Friedson, who has been working with EveryMind, along with Council Members Jawando, myself, and I know Councilmember Rice and Councilmember Glass have intimately been involved in a number of mental health issues. And I'll just say that we are so fortunate in Montgomery County to have organizations and partners such as EveryMind, who are an extension of the great service and work that we provide through the Department of Health and Human Services. And so this special appropriation is important. It will help continue to stand up and provide services to our youth and some of our most vulnerable within our population. And with that, I'd actually like to turn it over to Councilmember Friedson to make some opening comments as the main driver of this particular initiative. Councilmember Friedson.
Thank you so much. I really appreciate all of your support. I'm so grateful to all colleagues. And as the discussion leading up to this discussion demonstrates, this is an all hands on deck situation when it comes to addressing the mental health challenges in our community. That's true in our schools, it's true outside of our schools, it's true with our young people, it's true with our aging adult population that also face significant challenges. It has no boundaries and knows no limitations. This is something that is everywhere, and it needs the support of everyone, and we need to make sure that we can be everywhere, or as much as everywhere as we can. And I'm so grateful to EveryMind who has just done an outstanding job and need help. I think when we talk about public-private partnerships and our local nonprofit providers and the partnerships that we have in Montgomery County, which I think is some of the secret sauce to making Montgomery County the type of place it is, front of my mind is this partnership that we have on mental health services with EveryMind. And what makes this so great to me is how much it leverages community support and volunteer support and all of the help that is coming in, not just in what we are funding, but what that helps to leverage beyond what we're funding. I know we will probably hear about all of the amazing and extraordinary needs of EveryMind in every moment, but particularly in this moment right now with COVID, with all of the social isolation and the anxiety and uncertainty and financial insecurity that calls are up 25%, that there are excruciating needs, and for us to step up here I think is so critical. And we're talking about a crisis intervention hotline. Missing a call, missing a text is a matter of life and death, and Montgomery County should be a place where we don't miss those calls, that we provide the resources that are necessary in order to make sure that there's always somebody at the other end of the line when one of our residents is calling for help. And that's what this is all about. It is a continuation of efforts last year that we took, worked with Councilmember Jawando to extend into the nighttime hours, and we had tremendous support on the County Council, and particularly from this committee, which we continue to be grateful for, those 9 to midnight hours when young people in particular are most isolated, have least access to resources. And this is really corollary to that because it will help to extend into the morning hours before noontime, where, from my understanding, about a third of the calls are coming in, and when there are additional challenges as well. I think this is the beginning of the effort that we need to continue to do. This is not the start. This is not the end. This is the middle, and look forward to working together with you and appreciate the partnership. And I did just want to thank Miss Yao and Rose Hacking in my office. Have been working really closely with Everymind, Ann and her staff, and just want to thank all of you. That's really how this has been made possible at a really tough time for everybody, with everybody being pulled in a lot of different directions. So I just wanted to extend my thanks to you all as well.
Thank you so much, Councilmember Friedson. And, we have had a lot of discussions about reimagining public safety and are investing a lot in the mental health space in particular, because it's all connected. And so this is just another example of an important step moving forward to establish the mental health infrastructure here in our community that has very real ramifications for our residents. So with that, Ms. Yao, I will turn it over to you to set the context, and then ask Dr. Crowell and Ms. Mazur to make some opening comments after you establish that context.
Okay. So what the committee is reviewing today, again, is a $395,000 special appropriation for the Everymind Hotline. $300,000 of those dollars are designated federal grant funds that will allow the hotline to continue at a higher level of service that they've been operating under during COVID. They had some funding, a one-time funding from MCPS that in fiscal year 20, but that funding did not continue in fiscal year 21, plus additional supervisory and management support of those additional staff and services. In addition, $95,000 of the appropriation will be supported through county general funds to expand the shift for the tech services that are used a lot by our young people. And again, we heard how much need there is to support the mental health situations for young people in our last discussion with the HHS and ENC committee. Also, in addition, the committee will be also recommending or deciding about an amendment to the fiscal year 21 operating budget resolution for a non-competitive contract award for Everymind for these funds. Council staff just wants to note that the funding for the expanded services will run through December, and because we are targeting CARES funding for those services, but it gives an opportunity for the committee to come back in the fall to talk furthermore about the long-term demand for hotline services and whether additional non-county resources will be available to support the hotline. As the committee had already reviewed the Crisis Now model and Nexus Montgomery's application, there will be a chance to again talk about call center services and how we should be moving forward with those. So this, the timing of the funding that's going through this appropriation will allow that kind of more expanded discussion to happen in the fall.
Thank you, Ms. Yao. Perfect. Dr. Crowell, would you like to make some opening comments or thoughts on this specific appropriation or in general?
Sure, Dr. Raymond Kroll, Director of Health and Human Services. Good to see you all again. And I will say, some of this is has a familiar, my comments will have a familiar ring to them in terms of where we are in the world right now and where we've come. But I want to back up and talk a little bit about our relationship with Everymind, which has been storied and going back to the days when it was Mental Health Association of Montgomery County and Mental Health America of Montgomery County, and now Everymind. I think our initial framework, our initial relationship with them, with Everymind was around this issue, was around hotline service, because the Crisis Center has been the 24/7 Crisis Center call line since I was probably 14 or so, it seems. But I think that there was a need in the early days to stand up a hotline for people who would call in, who would be anxious, worried, not necessarily at the level where they needed to have a mental health clinician come out or have it or come into the crisis center, but with provisions for them to do handoff to us in response to when things got a little heated. And so they staffed it and manned it and did a phenomenal job. I've not had a chance since I've changed jobs to look back at the the data in terms of the numbers of calls that that Every Mind is experiencing, both under COVID but I do know that before I left, those numbers had gone up tremendously, and as I've said over and over the years, that the severity of need has increased. So no question that we've had conversations with them over the years and increased budget kind of repeatedly. I look back at the budget for the last couple of years and realize just the volume rate at which we've increased budget and given and added more money to this process because of the volume. And along the way, we've also had a growing partnership with Every Mind that has expanded and grown in a number of different directions, especially related to behavioral health, but also to homelessness outreach and services to our homeless community as well. The thing in this moment, I think, is that we face this challenge with COVID-19, where no doubt the things we talked about in the last hour are true for the folks that are going to be calling in to the hotline and looking for support. The stress, the anxiety, the fear, the depression, the suicidality, the loneliness are things that bring people to that hotline. And they have continued to be a good partner in making that referral and that transition over to crisis center. I can't tell you how many calls I suspect that 311 doesn't get because we have this hotline number, which I think adds value to it. We have been working on the Crisis Now proposal along with Primary Care Coalition to try to put that in place. At the same time, we've been working with council around the mobile crisis outreach teams and to add clinical service to the county, mobile crisis clinical service to the county, and thinking about how do we build this Crisis Now model. And a piece of that does have to do with call center. And we're in the odd position of having several places that could now call themselves the crisis call center. And so the challenge for us going forward is to figure out how do we integrate that and make that into a unified process. And I think the Nexus, the Crisis Now proposal gives us a potential leg up to do some of that. As we get through COVID, and we will get through it, and as we come out of the shadows of this disease, I think we'll be looking at a vastly different system, and a system that I think is supported by this appropriation, but one that has set the stage and this will set the stage for what we need to build going forward in the future. So those are my comments for the moment.
Well said, Dr. Crowell. I appreciate that. Ms. Mazur, would you like to make some opening comments?
I'd love to. Thank you all for inviting me to participate again. And I also want to start first with a big thank you to the lead sponsors, Councilmember Friedson and Juando and Albernaz, the co-sponsors. And I know this committee, the HHS committee, Councilmember Rice and Councilmember Glass, and the fact that this appropriation has full council support, the partnership and the conversations that all of you spoke about, so important. The work that we've been doing over the last month, not just years, to Dr. Crowell's point, with Vivian and Rose and Dr. Friedson, in Councilmember Friedson's office, and Beth in your office, Councilmember Albernaz, as well as Pam in Councilmember Juando's office. Huge thank you, because the amount of work behind the scenes, I know you all know, but from my perspective, incredible work from the team and the staff. And as Dr. Crowell mentioned in his former position as Chief of Behavioral Health, we have a long-time partnership working, and he's in that other role was a driver and supporter in all of these efforts to expand the work. I would just reiterate many of the comments that were made by those that have already spoken, that this partnership and your leadership is so appreciated, and that this really is a first step. And as we talk about the crisis response infrastructure within the county and the Crisis Now model and what that looks like, we're looking forward to those conversations. One of the other things I'll add to that conversation, which prior to COVID was part of our information and ask that we had was, but to just put on the radar for this group also is that the FCC is moving forward with a 988 number, which would be replace that 1-800 suicide lifeline number nationally. So it would be a 988 versus, like a 911 number, which is anticipated to skyrocket calls to National Suicide Lifeline. I just saw an update last month. They actually had the FCC director on the Today Show. I happened to have it on that morning, and it looks like it might be 2 years out from when they actually do that switch. But they have the approval. They're moving forward with that. But that's another important component that I think that we're trying to get the infrastructure in place so that we don't feel like we're at a shoestring. And really what we feel like this last quarter of fiscal year 20 and what happened with COVID, it almost was an immediate jump maybe to what we were anticipating with 988 in the future. With that 25% spike in calls, that volume has continued over the past few months. And so this funding, this CARES money that allows us to continue that staffing through December is critical. And I also look forward to the conversations that Councilmember Friesen and Vivian referred to as we talk about the Crisis Now model and we look at how we can sustain this level of staffing, after December of 20 is one of the other important components. We also, we know our ultimate goal is to make text and chat 24/7. This addition of the 4 hours of 8 a.m. to noon is critical. And that expansion is going to really have a great impact. And one of the things Dr. Crowell referred to with the data, we're tracking and looking at that data monthly. And we had a lot of conversations with Vivian as well that we staff and adjust the staffing based on the data, right? If we're seeing, a lot more calls or missed calls, from noon to 3 or, midnight to 2 a.m. or whatever that might be, we're looking at that month on month or, every kind of 6 months, do we need to make some adjustments? And that's also as we garner additional funding, we look to make sure that we're putting that staffing where the trends are and moving that. So that flexibility of addressing where the need is and what time we're seeing the spikes is really critical and important. So we appreciate that as well. The other piece that I would add a note, we've had a lot of conversations with Councilmember Albernaz's office regarding cultural competency and adding, bilingual Spanish and potentially other bilingual capacity. Currently, we don't have that capacity. We do hand over to the Crisis Center, to Dr. Crowell's point. We are working with the Crisis Center every day and currently send those, if we have calls for someone that is non-English speaking over to the Crisis Center. But we have begun through all the conversations with Councilmember Albernaz's office, we have begun to highlight in our recruitment efforts, call specialists that have bilingual capacity, and so that we can start to build that capacity. And, it's a difficult piece because if we don't have it built, it's hard to promote and advertise, and we don't want to promote and advertise if we don't have someone that's going to be there to answer that call for a non-English speaking resident. But it's capacity that we're trying to build, and maybe it's also a staged approach that as we build that capacity, we could add certain time frames of the day that we could promote. So that's one of the other areas that we look forward to continued conversations there. And then just one other note is that Dr. Crowell was talking about the hotline and how long it's been in existence. Actually, this year is the 50th anniversary. We're celebrating the 50th anniversary of the hotline. And before
So I was 14.
Right, exactly, right? So we were, unfortunately, before COVID, planning events around celebrating that 50th anniversary and bringing people together, and also helping to try to raise funds to help leverage the county funding, to continue to sustain the hotline for another 50 years. And so you were right, Dr. Kroll, that 50 years. And I think everyone on the call knows Chuck Short, who actually last winter when I ran into him and we were talking about this, he was one of the individuals that originally started the hotline 50 years ago. He was a part of that. So he was going to be a part of the celebration. We'll do some kind of celebration sometime this year, but just don't know what that's going to look like. And then one other point I do want to emphasize is that this funding for us to add these additional full-time equivalents is absolutely crucial for us to have some paid staff we have right now currently many hours of the day that is only volunteer staff, right? So we were at least looking to try to, have some paid staff, add some additional paid staff. That in no way is reducing our outreach for volunteers. That will continue, because even with this additional funding, we're still going to have the missed calls, right? Pre-COVID, we had 1,000 missed calls a month. That's right. That was our gap pre-COVID. So we're going to continue to recruit volunteers and leverage that with volunteers. But if we can have a cadre of paid staff supplemented with the volunteers, we're getting closer and closer to having, no missed calls, hopefully, right? That's our ultimate goal, and no missed text and chat, and being able to expand those hours. So thank you again, and I'm happy to answer any questions and about my comments or anything within the staff report that I know Vivian covered very well.
So, Ms. Orr, thank you so much. Just a couple of follow-up items to your comments, and they're so appreciated on every level. I learned a couple of months ago when participating in the Asian American Health Initiative meeting that there has been a spike in calls within the Asian community, in part because of the rhetoric of our president regarding the virus and people feeling disproportionately impacted, and there had been a spike in suicide calls from people speaking Mandarin Chinese, Vietnamese, Korean. And so the bilingual aspect is so critically important. And I think there may be an opportunity on the horizon, and I so appreciate you focusing on in this space, because the Census Department, especially locally, has done a great job of recruiting folks who have not been able to be dispatched because of COVID. But they hired many multilingual people. And so I think there will be an opportunity to intentionally partner with maybe WorkSource Montgomery, and I'm looking at my one member of the Fed committee represented on our call here. But I think there could be an intentional approach to specifically recruit people, because we're all concerned about the economic recovery. We're all concerned about the second wave of COVID. And I think we're at the tip of the iceberg in terms of the calls that are going to be coming into the crisis center, particularly among our youth going into the upcoming year. And so everything we can do to support your team's efforts. And in the past, the challenge among many has been just finding people that have bilingual ability and an interest in staffing these lines. But we're going to have a lot of people who are looking for employment, gainful employment. And these are good jobs, tough jobs, but good jobs. And so I think when we reconvene in the fall, would love to explore between now and then some of those potential options through WorkSource, the Census, and others that we might be able to identify some folks. And I appreciate you acknowledging Beth in my office, who is such an outstanding resource on so many different levels, and everyone that has worked on this. And then I'll stop for now before turning it back over to Vivian. I'm glad you mentioned Chuck. And when we get back together, the council's going to do something a little special for him too. He served under every single county executive in the history of our county, and his fingerprints are all over this county in terms of like the best, a lot of the best of the best. So we will follow up on that too. But with that, Ms. Yao, if you could walk us through the packet, are there any items specifically that we need to address or that are of concern?
No, just that you would want to make a recommendation to the council about this appropriation. And again, if you would like to come back in the fall to discuss this, we can make sure that it gets on the calendar.
Definitely would like to discuss the broader issues in the context that we talked about. And if I could get a motion from one of my colleagues to move the recommendation for this special appropriation full council.
Moved.
So we got a motion from Councilmember Rice, second from Councilmember Glass. All those in favor, please raise your hands. That is unanimous. So that will go to full council as soon as possible. Anything else, Ms. Yao? No. Councilmember Glass.
I just want to say that I know Councilmember Rice are listening, right? But for anyone who wants to hear our thoughts about the need to improve mental health services at this critical point in time, there is 90 minutes of a joint committee we just had with the Education and Culture Committee that anyone can rewind the tape and hear us at length. Critically important, but for sake of brevity, and thank you for everything that you're continuing to do.
Yeah, ditto to what Councilmember Glass said. I mean, there's just no question. And thank you so much for your continued work. You know how special you are and why you guys are so important on so many levels, even the intersection between homelessness that Councilmember Glass deals with and with mental health and ensuring. So there's just so much intersection, but yes.
Great. Well, go ahead, Councilmember Friedson.
Yeah, just really quickly, thank you so much, this committee. I appreciate the very long, robust, and comprehensive conversation that happened prior to this, which directly ties into this. I hope to be back for the broader conversation because I think it is so critical to figure out how we address these issues comprehensively. But this is the immediate need that we are meeting right now in the moment, and we need to have that broader conversation. And I just wanted to say I really appreciate the in-depth conversations I've been able to have with Councilmember Alvarez on the broader cultural and language competency questions about the whole continuum of mental health. Because just like every other aspect of our health and human service provider network, this is an area where we're just not doing good enough, and it has nothing to do with this particular organization, this particular service. It has to do with everything. And I really do appreciate all of your leadership, not just on this particular item, but on the broader set of items, because from mental health to physical health to public services, we've got to do better in that department, and it's become acutely aware to everybody beyond those who are directly impacted, and I look forward to being part of those conversations and just thank everybody for their leadership on this.
And I'd be remiss if I didn't acknowledge my hermana on the bilingual issue, Councilmember Navarro, who obviously is intimately engaged and involved, and her staff has been incredible in translating a lot of what we've done on COVID, press releases, you name it. So look forward to the ongoing discussion on that. So thank you all so much. With that, I believe we are adjourned. Have a great afternoon.
Take care.